Hello everybody, this is Dr. Menna Nagy, and in this lecture we will talk about a catastrophic health expenditure. What is catastrophic health expenditure, what are its consequences, and how to avoid it. First of all, what is catastrophic health expenditure? Catastrophic health expenditure is the out-of-pocket health payments that exceed the financial capacity of the individuals. This occurs at the expense of the basic life needs, like food, clothing, and dependents' education. In 2005, it was estimated that more than 150 million individuals around the world were exposed to catastrophic health expenditure every year. This, in turn, has led to the impoverishment of around 100 million individuals yearly. So, how is the catastrophic health expenditure related to the Sustainable Development Goals? In 2015, the United Nations General Assembly set the Sustainable Development Goals, which aim to end poverty and inequity in all aspects, including health, and protect the planet, and these 17 goals are to be achieved by 2030. Sustainable Development Goal number 3, or SDG 3, is achieving good health and well-being. This includes universal health coverage, which implies financial risk protection and the protection against catastrophic health expenditure. So, when can we consider health expenditure as catastrophic, or how can we calculate the catastrophic health expenditure? The World Health Organization identified the health expenditure as catastrophic when it exceeds 40% of the household's non-subsistence income, which is the income available after meeting the basic needs. Another definition identifies catastrophic health expenditure as the out-of-pocket medical costs which are higher than 10% of the monthly household income. So, we have defined the catastrophic health expenditure. What are the consequences of the catastrophic health expenditure? As we have said, impoverishment of the individuals who pay out-of-pocket expenses because it acts as a burden on those individuals. Those who are already poor will be poorer through the indirect cost of lost working days, especially if those working days are uncompensated. Increasing the burden of illness among those who cannot afford to pay for the direct medical costs of medicines and healthcare professionals' costs. Also, they are overburdened by the indirect costs of transportation and other expenses. So, what are the main causes of the catastrophic health expenditure? The main cause of catastrophic health expenditure is the failure of the financial protection of the more vulnerable groups, including the elderly, the handicapped, and those with chronic conditions. Also, the rising prices of the health care and the lack of proper health insurance schemes, which lead to an increased out-of-pocket payments. With all these factors contribute to the catastrophic health expenditure. So, we have some experiences from different countries which show multiple variables that contribute to catastrophic health expenditure. For example, data from 133 countries showed that in 2010, 808 million people faced catastrophic health expenditure. The trend of catastrophic health expenditure has been rising from 9.7% in 2000 to 11.4% in 2005 and 11.7% in 2010. A study in India has showed that there is an association between the socio-economic status of the individuals and the catastrophic health expenditure, where individuals with lower socio-economic status are at higher risk of catastrophic health expenditure, which shows a sort of inequity. Also, there is an association between catastrophic health expenditure and chronic illness, where households with chronic illnesses have higher catastrophic health expenditure, the majority of whom were suffering from diabetes mellitus and hypertension. Another study in Peru showed that individuals living in rural areas have higher probability of suffering from catastrophic health expenditure than those living in urban areas. The highest out-of-pocket expenditure were found to be spent for medications, and this represents 61.54% of the total out-of-pocket expenditure. Also in Nigeria, it was found that catastrophic health expenditure is associated with education of the household head, where those who have received no education and lower education levels than post-secondary education had a higher probability of suffering from the catastrophic health expenditure. Also, the socioeconomic inequalities have contributed to the catastrophic health expenditure in Brazil. This is reflected in the significant increase of catastrophic health expenditure in Brazil between 2002 and 2003 and between 2008 and 2009, becoming 5.2 times higher among the poorest and 4.17 times higher among the least educated. So, from those studies, we can conclude that there are factors that contribute to the catastrophic health expenditure, like the low socioeconomic status, being in rural areas, especially in some countries, and the poorest are at more risk of suffering from catastrophic health expenditure. So the next will be, how can we protect the individuals against catastrophic health expenditure? Here is the role of the policymakers to protect against the catastrophic health expenditure. As protection against catastrophic health expenditure involves policies on risk and financial pooling. Risk pooling involves sharing the financial risk through prepayment methods, such as taxes and collection of the contributions of the insurance. This means that the individuals who are more vulnerable won't be more burdened due to their vulnerability, like those with chronic illnesses or those with old age. In other words, those who are at lower health risk share the payment of those who are at higher health risk, which in turn ensures equity. The benefit of healthcare packages designed to reach universal health coverage must be extended to cover more groups, with more focus on the more vulnerable groups, not just the low-income ones. Additionally, the covered services must ensure the protection against catastrophic health expenditure through including a wide range of services. Financial risk protection is an inevitable principle of universal health coverage and a health policy mandate. The prepaid insurance and mandatory contributions are proven to be more efficient in the protection against catastrophic health expenditure than just increasing the amount of gross domestic product spent on health. In the light of the global concern of financial protection against catastrophic health expenditure, there must be plans of protection of the individuals against catastrophic health expenditure, which can be through social health insurance and risk pooling plans in addition to tax policies. So, in this video, we have explored what is catastrophic health expenditure and the drawbacks of impoverishment of the catastrophic health expenditure. Also, we have explored some of the main reasons of the catastrophic health expenditure and the presence of inequity in some countries and experiences from some countries. The consequences of the catastrophic health expenditure are very clear in this video. Also, we have explored the methods of protection against the catastrophic health expenditure, such as the risk pooling and the prepaid insurance schemes and tax policies. Thank you.